rolling.
Okay.
So what's up, man?
What's up? What's good? It's the new year.
New year, new me.
Hell yeah, that's what they say.
Who's they?
I don't know. So what you been up to? How was the holidays? How was
Holidays was treating me good.
Yeah, ate a lot of good food, some gains.
I've been eating a lot of food.
Oh yeah.
I don't know if I've been getting any gains now.
Just eating, no training.
Yeah, almost like that.
Almost.
I've gotten one session between Christmas and New Year's. One session post New Year's. No, actually two.
Okay.
One like a few days ago. So,
yeah.
But I'm getting back into it now.
Okay.
Feeling sore.
Yeah. You're doing the same type of training you always been, or are you switching it up for the new year?
No, my primary like goals are to increase my overall volume.
Yeah.
And just progress everywhere.
What?
Get big. Yeah.
Progress? You crazy? You don't want to stay in the same place?
Yeah. So tell us about your holidays.
Yeah, the holidays were good, quite different last year, if you will.
Yeah.
Because it was good until like Christmas Day, because in the morning of Christmas Day I woke up with a high fever. Or in the beginning I was like really suspicious of it.
Mm-hmm.
Felt like really weird. When I measured it, it was like 37. And it was like, that's not right. I feel crazy ill. And then maybe 1 hour later I got like a little bit over 38.
Mm-hmm.
So then I also tested positive for COVID. So it was quite a different Christmas holiday. Was isolated almost the whole week after, but I wasn't that sick. I had quite different symptoms than I used to when I get COVID. I think it was the third time.
Okay.
Not sure if it was the second or third. I think it was the third.
Yeah, I've had it 3 times too.
Yeah, so as I said, I got the fever. I always get the fever when I get COVID. Usually it starts with like mild throat issues, like having sore throat and those kinds of symptoms.
Yeah.
And the ordinary flu symptoms as well. But I didn't get the like sore throat at all this time. I only got the like kind of strong fever, because it was one of the worst fevers I had in years. I was pretty close
to dying. No.
Not to dying, but I think it was the second or third day I had very close to 39 degrees. And it's very rare for me to have like already over 38.
Yeah.
So that was kind of like the strongest symptoms. But then I also got the like breathing difficulties. I still have those like symptoms today. Even. No, man, I'm clean. So still having mild symptoms of that, but it's a lot better than it was, because it was like heavy, only going to the kitchen or going to like pick up the mail or something. But now it's more like if I talk like a lot without taking that much a break, I like feel it, because I have to like breathe more frequently. But I never got that like it hurts to breathe or really heavy to breathe either. It's like just I feel like I have to breathe more frequently.
Yeah.
And so that was that. So it was a quite calm and chill holiday, and New Year's Eve as well. On New Year's Eve, we took it easy. We went to a restaurant in Närpio, La Taverna, ate a New Year's like quite fancy dinner.
Yeah.
Steak and some
Okay.
wine sauce and those kinds of things. So that was quite good. And the rest of it just took it easy, because I didn't have the symptoms then, but I didn't want to go out either because, as I said, I've been isolated for a week, and it wasn't that I feared to like pass it on to others because I didn't have it then. It had been a week.
Yeah.
It was more like I need to take it easy because of my energy and like the breathing. It's like no point of it.
Yeah.
Of course, I wanted to like meet up with some friends I haven't seen like in a year, so that was like kinda sad and boring in that way.
Yeah.
But my girlfriend visited me on New Year's Eve, so that was good.
Yeah.
Yeah. So that's that, and with that being said, my training has been on a longer break due to COVID, and I decided I will take it quite or very easy now in the beginning.
Yeah.
Like now we only went to the gym, still going to the gym like one time a week, which is a very big change for me because I'm used to like going 3 to 4 times a week.
Yeah.
Mostly 3, but sometimes I could do 4. And doing and working out with a very high intensity. And now I'm like only focusing on deadlifting 80 kg and things like that. So it's a quite big adjustment for me. But I know I need I need to stick to it if I even want a small chance to getting back to my like normal capacity, especially if I want to like go back to the competition scene. So it's like the first months now in this new year, I will only focus on getting back to my old abilities and capacities. And then I can like start to think about how to adjust the training for like competition and things like that. But and as I talked about last year, I changed up my training a lot with the like raw training, taking away and deleting all of the like extra equipment like knee sleeves and belts and wrist wraps and so on. Even decreased my use of music as well. Only use it if I really want to lift heavy, but I haven't done that in a while now. So also that's on the break. But it's kind of nice, like just to be present in the gym and having no supplements or no like materials to help you. It's like what it was used to, what it was made for. Like you're only using your body, nothing else. It's like the independent training is like, it's really giving and important to try, I think. So that's that. But as I said, I'm lifting very light and only like, but I think it's a good way for me to only focus on my technique and form, not only focusing, but really getting down to details on specific lifts. I have done that before, but now when I actually can't lift heavier, or I could but I won't, I feel like it's easier for me to really just focus on the, let's say, just focus on the bracing technique, or like benching with the like balanced like symmetry, or like focusing on not letting the wrists extend too much or things like that, which are my like weaknesses. But it's easier for me to focus on them on that sort of like level now, I think. So I think it will be a good carryover, but as you stated before as well, it's not as easy to carry over like that. But it's a good start, I believe. Because I haven't been able to focus on it as strongly before, when I only had the like strength based and lifting really heavy before. So we'll see where it takes us. How about you? And like, if we think about the new year, do you have any resolutions or goals maybe?
Well, I mean, the gym ones are just to get bigger, get stronger, overall progression in all the lifts.
Yeah.
Increase in all the sizes.
Yeah.
But goals overall, I wouldn't say that. Maybe do a little bit more work, earn a little bit more money.
Yeah.
We'll see. I think the academics will have to be on put hold right now.
Yeah. Yeah, you talked about like a master's in occupational therapy, which you already have a, like, what is it, bachelorette degree?
Yeah, we have the bachelor's degree.
Yeah.
But I would like to get the master's as well. But I'm not allowed yet.
Not yet. It's like 2 years. Yeah. It's the same for me.
Yeah, 2 years with a license. And I don't know if we'd like send a letter and ask them like, hey, I've been working before I had my license. Would they like?
I think it's like an
look through the fingers.
Official application, and you can like ask.
Yeah.
How it's
maybe
how it's set up and how it works and things.
Because
like
I think you would have to apply now.
Yeah.
Like before the summer sometime.
Yeah, I'm thinking about that as well, but in other areas. But as for you, I have to work 2 years, and this will be my like last year before I could apply. I worked 1 year now in like psychiatric care.
Yes.
And it's like you have to work 2 years within that specific
area.
And my like aim is to apply and try to specify my like job and knowledge within psychiatric care, of course, but more specifically to become I'm thinking, like I said before, psychotherapist. Either that or try to apply again for psychologist. Because that's one area that has been like, the interest for it has been increasing a lot over the especially last year. So I have to like decide if I want the like psychotherapy or the psychology. If I could choose, I would choose the psychology at the moment, but it's a really big competition to get into that. So we see.
Yeah.
But I think my chances are bigger now because I've been working.
Yeah, continue.
Yeah, oh, man, it's the good light. Yeah. So I think I have bigger chances now.
Yeah.
I applied for it like before I went to study for occupational therapy as well, but I didn't get in then. It's like I had good grades in psychology, but the other subjects was quite mediocre. So I think you need very good grades overall for that.
Yeah.
So we see where it takes me, but that's my plan at least. Yeah.
Yeah, I mean, it would be awesome to get another bachelor's degree in something, but I feel like I gotta do some Sigma male grinding and get some cash.
Yeah.
Because then if you don't do that, you're gonna have to take another loan. And
that's true.
Yeah, you need some sustainability economically.
And that's a situation for me as well. I kinda don't need, but I probably will wait even after I worked 2 years to really gather and save up some stable income before, because an education like that, it's not free. What is it, like 2,000 euros is pretty standard price.
Oh, okay, I see.
Depending on the education, but that's like I am studying right now to become a personal trainer and dietitian as well.
Yeah.
That was like in Swedish currency. The crowns. The crowns is like 20,000, which is the same as about 2,000 euros.
Yeah.
A little different when the Swedish crown is pretty bad at the moment, but approximately.
Yeah. How is that going though?
Yeah, it's like that's a quite special education, but because it's mostly on like distance level. So it's like three things and factors you need to become a licensed PT. It's like you got the theoretical classes which you can watch whenever you want,
Mm-hmm.
like on the uploaded platform.
Mm-hmm.
And whenever you like read and watched all of those,
Yeah.
you can take the like
some tests
within some
taking test.
No.
Busted.
Yeah, there's some certain like areas that you take the tests on that's like more important than some others. For example, it's like anatomy, physiology, let's see, training, like science.
Yeah.
I'm trying to translate it.
Mm.
And some other stuff like dietary sciences
Mm.
and things like that. It's like 6 topics, I think, that you can take the tests on.
Yeah.
And when you passes all of those tests, there's only like the practical, like
That you have to do in person. Yeah.
yeah. Then you can choose to go to. It's a Swedish education,
Yeah.
so you can choose from a couple of like places in Sweden, and a certain time that suits you best.
Yeah.
And you go there over a whole weekend, like a very long weekend, long days, like from the early in the morning to late in the evening. Like I think it's 3 days, and then it's more like you get to try out how do you teach certain lifts, how do you lift them yourselves, because that's a big process of being a personal trainer, actually lifting them yourselves, because how would I teach something if I don't know how to like do it myself first?
Yeah.
So I think I haven't done the practical tests yet, but still yet to come, because I've been quite busy myself, so I've been putting that on hold. But that's the good thing about like this education, it's like no deadlines.
Yeah. Maybe we should search for bachelor's degree in exercise science in Jyväskylä. They have a really good school there for that.
Oh yeah,
They do. But I
Nice.
think it might be in Finnish. I'm not sure.
yeah, that's like that's the difficult part, because
But
not
it's
my strong suit. but-
Yeah, I think they have. I'm pretty sure they have the program there, and it's supposed to be really good.
Okay.
Would be cool.
Yeah, so that's on hold, but it's ongoing.
Yeah.
But I think that's good for me, because I work 100% right now in a psychiatric hospital, so I don't have time to like study within some deadlines or something, like just not suitable for me.
Yeah.
And on the other hand, I'm also quite active outside of work with training and socializing and those kinds of stuff. So I wouldn't have time to like study on that level. So
Yeah.
then it's good to like you could like watch a presentation or some of the theoretical stuff whenever you got time, maybe on the weekend, or chill when you actually don't have that much other stuff to do. So just a little at a time.
I think when I do the masters, if I do it,
Yeah.
I'm still going to work.
Yeah.
But maybe just not 100%. Maybe like 60.
Yeah, that's something I thought about as well. How would you like set up
Yeah. Well, then
like
you can
with your daily job and things like that?
I think you could do it like your daily job. You just go. You set like office work
Yeah.
as school work
Oh yeah.
for 2 days a week.
Yeah.
And you just
But,
grind Sigma male grinds it
Hell
just, on those days
Yeah.
with school.
Yeah, but left to see. We'll see.
Yeah. Should we move on?
We should move on.
Okay, a hot topic in the fitness industry
Okay.
fairly recently has been Mike Menzer
Oh yeah.
and his HIIT training, which was high intensity training. Mike Menzer liked to use heavy weights and 1 set to failure.
Okay.
And his rep ranges would be like anywhere from 5 to like 7, 8, somewhere around there.
With really heavy.
With heavy weight.
Okay.
And like really grindy sets.
Yeah.
And it's tough. It's like really tough training, but just one top set, because he was also a big proponent of warming up properly. A lot of people jump into a Mike Menzer protocol and they get hurt because they don't warm up properly.
Yeah, that's.
If you're gonna go balls to the walls with heavy weight, you better make damn sure that you're warmed up.
Yeah.
But his philosophy was like, oh, you train this one muscle group for like 2 failure, 1 set, and then you take like a 72-hour rest before you train the next muscle group.
Yeah.
So like, say I hit chest and triceps, which was like a common, you put those together, and then I wait 3 days to hit my legs.
Yeah.
And then 3 days to hit my back. So there was a lot of like, there was a very low frequency in the training as well as a low volume, low frequency, but very high intensity during that like 1 set, and you took it to complete failure where you could not like do 1 more rep.
Okay. That's interesting.
And that's like the Mike Menzer training. And he was inspired by Arthur Jones. And later known bodybuilder Dorian Yates was inspired by Mike Menzer's
the
training.
legend.
The blood and guts.
Yes.
What do you have to say about this training style?
That's quite interesting, because that's a similar type of approach which you learn quite early when you go over to the powerlifting route. You topping off.
Yeah, I'm topping up, man.
Okay.
Keep talking.
Yeah, so in powerlifting it's quite known with the like warm up thing. It's quite important. Something I also noticed myself, because I needed so many warm up sets.
Yeah.
To actually go to the super heavy stuff.
Yeah.
The problem with that is like the volume becomes insane, or like the sets, because in powerlifting you could already do like, or program between 6 to 10 sets before warm-up sets, and then it's like you only do 1 exercise within 2 hours almost. It's like, it's pretty intense, but I do like the idea of like only having 1 top set, which you like grind with really like extreme effort and intensity, because that's quite doable as well, because it's 1 set and it also challenges you on that level, because it's really putting a lot of stress and work on your whole body. Because doing those kind of rep ranges with really heavy weights it really takes a toll on your CNS as well. And that's what I like. It's a good approach, because that's something I don't like with powerlifting. It's like really stressful on your CNS and whole body, because you do these kind of sets, but you do it more than 1 set. Because you could do it, like I said, almost 10 sets. My first year when I like explored the world of powerlifting, I could have like 1 day where I had like 1 squat variation and 1 bench. That's it. I could have some smaller accessory movements like hyperextensions, or maybe tricep extension, or some smaller. But the compounds were like squat, bench, so I could have like, let's see if I remember, I think it was 1 day like 11 sets of 1 like singles, 11 singles of squats, ordinary squats. Then maybe 7 sets of 3 or 4 reps in the like a bench press variation, maybe Larsen press. Gorilla glute bench, or maybe more bench press variation which uses less leg drive, for example, or explores the angles of the movement or something like that. But I think it's a really interesting concept.
I think you can modify it and make it really effective. Like, you don't have to have 3 days in between your workouts.
No.
I think if you're training 1 muscle group like
Was there something left?
Yeah, there's
Okay.
more left. But I think if you are training, for example, one muscle group, like say chest and triceps, you don't have to wait for like 2 weeks until you can train it again.
No.
But rather you can already train the next day your legs, for example, and the day after that you can do back,
Yeah.
and then rinse and repeat.
Yeah.
Because you're not gonna get that fatigue from working up to one top set.
No, and that's one of the reasons, as I said, why I think it could be a good.
But I think this
Option.
method is really good to have in your back pocket if you're short on time.
Yeah.
To
Oh, yeah.
like, okay, I have to get these workouts in. What should I do? I'm stressed. I need to do a lot of other stuff. Life is busy. Then I think the one set to failure method is very nice.
Yeah.
I have been occasionally utilizing it.
Yeah.
Because it's well, I might build some muscle on this actually.
Yeah.
But I'm sure as hell not losing any muscle.
Oh. It's like, have you been doing that for a long time? Or
Well,
recently?
I maybe a little bit recently, but I've been throwing it in every now and then when I haven't really had proper time to like get my volume in and do quality sets and all that good
That's
stuff.
Something
So
I could
just
consider. Yeah.
Really focus on that one top set.
That's interesting. I could consider that because I really like to explore and try new things, even if I don't know if it's effective or not, just to try it out. One thing though I haven't tried, but I read up some on it, is German volume training.
Yeah.
You heard of it?
Yeah, I've heard of it.
And that's for the folks out there, is you could train one, let's say it could be a compound of some sort, and you do 10 sets of 10. Sounds really, really crazy.
Yeah.
But in my mind, I've been wondering, when would it be the most appropriate time to incorporate this? Would it be when you're on a caloric surplus, caloric deficit? Would it be when you're training for strength or hypertrophy? Do you have any thoughts about this?
I think definitely when you're doing a hypertrophy block and when you're in a caloric surplus.
Yeah.
Because
you can't do that when you're cutting.
You might accrue more muscle damage than you want.
Yeah.
If you're in a deficit already, that might not be that good. And I can see the purpose of taking 2-3 weeks with German volume training, because you're really gonna get that muscle inflammation and swelling. So you might notice that you get bigger right away.
Yeah.
From doing German volume training.
I agree. The most important thing here is, yes, you need to do it on a caloric surplus. There's no other way. And I do believe as well it could be most effective if you're aiming more for hypertrophy. But
I've heard a lot of people lose strength on German volume training.
Oh. Yeah. My point would be here that I wouldn't use it frequently if I would train for strength.
Yeah.
But I could use it as an alternative day in a powerlifting block. Let's say I do a powerlifting block on maybe 4 days where I have squat, bench, maybe a bench deadlift, and maybe overhead press row day. That's 3. And then I could do the 4th, even if it's easier weight.
Yeah.
Do a German volume day with a certain muscle group which you need.
Full body.
Full body. And you could even take one of the earlier powerlifting days away to make that German volume training day more not easy, but more appropriate, if you will. Could be option to add or to explore. because in powerlifting, that's one of the most common like mistakes you make is that you forget about like the high rep stuff. That's what I did. I read up on powerlifting. It's like do a lot of singles, a lot of like low reps of weight, which is a big part of it.
Yeah.
But what you need to understand is like you need that balance, you need that endurance to be able to move that weight in the first place.
Yeah.
Because like I talked about before, I had like this difficult to do more than like 5 to 8 reps, especially in the squats. Immediately when it came to like over 5 reps, it became heavy. didn't matter if it was like 1 plate or 3 plates. So I didn't have the endurance. I had the strength in some ways, but my strength couldn't develop and increase as I wanted to because I lacked the like endurance for it. Because the endurance works as a like foundation for it all. You need that to be able to operate and like I said, develop more and more and more.
Yeah.
So that's why I also added these like I've tried the squat every day approach. I tried the like super high rep like that's still one of my more common routines in my training today is that I often finish like a compound movement or a compound set as the last set with an AMRAP. Let's say I could do an ordinary sets of squats and then I add like a last set which I just pump as many reps as possible with just 1 plate.
Yeah.
Just to increase. And for me it's like a mental thing, like mental power, because then I learn to not maybe give up after 10 reps just because it gets heavy.
Yeah.
And now I can like the most I've done with the like 60 kg I think is very close to 30 reps. Not right now, but before when I was in my peak last year, I remember it was pretty close to 30 reps. So that was a big deal for me because that's always been my weakness. And I think it's very important whether you train for hypertrophy or strength. Yeah.
Definitely. I think if you're not necessarily getting stronger by doing singles either. You're more just realizing and actualizing the strength potential which you already have accrued from all the other lifting.
Yeah, because the doing singles thing is more like adapting your CNS for the heavy weight, which is really important, But when you got that, you also need to incorporate, as I said, the like endurance to be able to move the weight. So
I'm gonna go on a marathon. Right?
Hell yeah.
Yeah.
But interesting approach. I would definitely like.
Well, it's not
think about
optimal, but
No.
it's a very viable strategy. I think.
But I don't think I necessarily will incorporate it now, at least. But I will surely think about like it in the future. Yeah, good stuff.
Well, should we move on?
Yeah.
Okay. Next topic is hair loss.
Oh,
As you can tell, new year, new hair.
Hell yeah. Looks good though.
Yeah, thank you.
You make a good look in that short hair.
Got that buzz.
Yeah.
Well, I want to talk about hair loss because it's something I've dealt with myself.
Yeah.
Got a little bit of the eagle's peak coming through.
Oh, hell yeah.
Got some thinning going on. And I think it's okay. Men, a large portion of men will start to lose their hair.
Yeah.
At some point. You could say like 60% of men in their 60s will suffer from some type of hair loss. Either a receding hairline or thinning in the back, on the crown, or all over, diffuse thinning. And like 50% of men in their 50s, 40% of the men in their 40s, and so on and so on. 30% of men in their 30s, and 20 in the 20s.
Yeah.
So it's common, but it for some people it's really fast. Some people start balding when they're like 15 and they have a clean head when they're 22.
Yeah.
I was sort of lucky in that way that it started at maybe 21, 22.
Yeah.
And it's been very slow, progressive hair loss. And it's part of, it's not, you can have hair loss because of some disease, stress, or scarring on the scalp, stuff like that.
Yeah.
But what I have is male pattern baldness, is why most men lose hair. And that is caused, most frequently we think it's caused by DHT, which is dihydrotestosterone.
Yeah.
It's a derivative of testosterone, and it's an androgen which is responsible for secondary male sexual characteristics such as your balls growing when you're in your puberty, your penis growing, and chest hair, beard, prominent male characteristics.
Yeah.
Well, one of the side effects, if you have a sensitive scalp for this androgenic stuff, is balding. Your hair starts falling out because DHT can, if you're sensitive to it, start to make the follicles of the hair smaller, which makes the strand weaker, and it shortens in turn the growth phase of the hair, and eventually it stops growing at all, and it becomes like a dormant, dead hair cell.
Okay. Interesting.
And there's a couple of ways of dealing with this. You have the natural route, but first of all, your bread and butter is gonna be to go to a doctor. Don't listen to me. But second is to get on finasteride. You can take it as a pill or a topical ointment. We don't really know that.
Is it like a supplement?
It's a medication.
Okay.
It's a drug.
Yeah.
It's you need a prescription to get it in this country.
You need a dealer.
You need a dealer. I know there are countries where you don't have to do that, but I think you should have a doctor to oversee your use of finasteride. Usually finasteride is used to treat enlarged prostates, but that's at a higher dose of finasteride, a pill. But they noticed that, oh shit, my hair grew back for a couple of patients that used finasteride for the prostate problem. So they thought, oh, wait a minute, there is something going on here.
That's something.
But there's a lot of side effect at that high dose, which they use for prostate cancer and also benign prostate hyperplasia, which is non-cancerous prostate enlargement. That would be at a 5 milligram dose. Commonly for hair loss is a 1 milligram dose.
Okay.
So a lot less. But I've also heard of people using 0.5 milligrams.
Really minimal.
Yeah.
Okay.
Or taking the 1 milligram pill every other day. Stuff like that.
Yeah.
But I think follow your doctor's advice. Use them 1 milligram a day. And this is something that systemically blocks DHT.
Yeah.
It blocks about 70% of your DHT. And I could add as context that 10% of all the testosterone you have in your body is going to be converted to dihydrotestosterone downstream.
Yeah.
And another part of that testosterone is going to be converted to estrogen. And in the fitness industry, we have this like dark horse, the estrogen. Oh, you don't want to have estrogen. It's the female hormone. No. Estrogen is good for you. It's what drives your sex drive. It's good for all sorts of things. We need estrogen as well as men.
Yes.
So I don't think we should villainize it, but that I digress. I was
but it's quite Yeah, villainized, if you will.
Yeah. But back to the finasteride. This is like what you want to use if you want to sort of slow down your hair loss, or like maybe even stop hair loss.
Yeah.
It depends. It might not work for you. For some it's great.
Yeah.
It's all they have to use. But there's another big player in this game, and it's called minoxidil. And this is most oftenly used as a topical ointment, which you put on the scalp, usually on the crown, but you can put it in the areas which are thinning or balding.
Okay.
And this, we don't really know how it works, but we know that it promotes blood flow to the area where you put it. And when you get that blood flow, hair starts growing better. The hair like grows thicker, and it can even like bring back some of the like dead hair cells.
Okay.
Which is kind of cool.
Yeah, that's kind of cool.
So if you, for blocking and stopping hair loss, you take finasteride, and for new hair growth, you take minoxidil. You can also get minoxidil as a pill. That's originally how they used the drug for blood pressure. But they found as a side effect, holy shit, my hair is growing. So you can take it as a pill, and there are of course side effects from both of these things.
Yeah.
Side effects from finasteride, there's a 3% chance of getting the side effects. Online, you're gonna find a lot more people getting side effects than the 3%, because I think if you're getting the side effects, you're going to search up online for other people getting side effects, which sort of, it becomes a cesspool of people having side effects. But supposedly it's 3% of people get side effects. That's 1 in 30. That's a dice you have to roll if you want to stop your hair loss. And that's the finasteride side effects. They include depression, penile shrinkage, erectile dysfunction, lowered libido, anxiety. There's a long list of things which aren't pleasant, but hey, 1 in 30.
No, but I ain't taking no chance. I want the libido.
And the side effects of minoxidil, I don't know how many people get the side effects. They're, I think, less common to get side effects on minoxidil. The most common there, though, is like redness of the skin and irritation, headaches, heart palpitations, and worst case, I think this is like 1 in 100,000, you get like where the growths of bones and shit, stuff like that could be awkward. But that's why you should have your doctor, which you talk to beforehand, before you jump on any of these drugs, like, hey, I want to fix my hair. That's what you say. And they'll set you up with either minoxidil or finasteride. Now it's recommended that you do first 1 year of finasteride, see if it works, and then if it does work, good, maybe you don't have to get on minoxidil. Or if you want to start with minoxidil, start with that. And it works for 67% of people. But you could turn yourself from a non-responder of minoxidil to a responder if you do microneedling.
Okay.
Which is, you could have a sort of a derma roll. It's sort of a roll with needles on it, and you just roll it on your scalp. Or you have a stamp, where you stamp needles on your scalp. Or you have a Dermapen, which is a electronic device which shoots the needles out very fast like that. Shit. I have one of those. Okay. And you just rub it all over your scalp where you feel like you need that.
Does it hurt?
Yes, it hurts like hell. But that would cause acute inflammation. And you don't want to overdo this. You want to do this like every once a week, maybe every 10 days, every other week, something like that. So you can like recover from the first one. Because if you don't recover, you're going to cause scarring, which makes no hair grow.
What?
Yeah.
I'm baffled.
But if you combine minoxidil with a dermapen or a roller or microneedling in general, it's most certainly going to be effective.
Interesting.
Yeah.
Really?
And
Yeah, because
if you want to take them, wait, do you want to talk about some of these? What do you have to say about these things?
no,
Because I think after this we're gonna go into the natural route of things, or the more easy if you don't want to take the drug route.
yeah, no, as I was gonna say, I really don't have anything much to add because I'm not that like into this topic because I haven't had the need for it. Because as you can see, blessed with the Maybelline hair.
Got that Ronald Reagan hairline.
No, but that's always been one of my like, not strength, but something, you know.
I got a strong hairline, bro.
It's one of my good things about
well, you can say it's a good attribute.
Yeah,
for
I've
sure.
always been proud of my hair and hairline. Always had, like, especially my hairline has been quite good actually.
Yeah.
And really fast growing hair as well.
I think even if I am like a bit thinning, I feel like it grows fast as hell.
Yeah, because I maybe not have to, but I get my hair cut one time each month.
Oh.
Quite expensive, but it's like it's really fast growing. And sometimes, hey, I could even want to like try to save it more than a month to see how long I can get it, but I really haven't gotten that like.
Then you have to like style it and
wash
it
and
better
I like the short hair. I really do. In the past, I've just often just taken away a lot around the head itself and like left this.
On top,
Now I cut it all, but still very short. So I think that's.
I think this is by far the most comfortable haircut I've ever
it's
had.
really comfortable.
It's
I've
so
had
nice.
that same type of
feels
haircut
really
as well.
good.
Yeah,
it looks a bit goofy at times, but
except from the military times, I also had it when we were in Sweden. I think I had my buddy Philip. Shout out to Philip. I was like, I think it was before Brännbollsyran, a Swedish festival. It's a really big festival, but I think it was a couple of days before the festival would start. I want to get a new haircut.
Yeah.
Like, and I know he likes to cut hair for his friends and that kinds of things. But could you cut my hair and surprise me? It's like nothing else to it. But I think he just said, let's do the Zidane, you know, the French football player, soccer player. He's like all bald.
Yeah,
so
okay.
Or the Wayne Rooney, I don't remember what he said, but those are two bald soccer players. Yeah. But let's do it. I thought he was joking until no, I'm not joking. But what the fuck? But it was really good.
Yeah.
I think it was a good look as well, but it looked weird in the beginning. But it's really comfortable.
I like when I walked past the mirrors the first days, I had to look twice because I was like, "What the hell? Who's that?"
Is that me?
Yeah, but now it feels comfortable. I feel it looks okay. So, it feels great to have it.
And for you, that's maybe research more in this topic. I don't know if you know a lot about what I'm about to ask, but what do you feel is a quite common and effective route to prevent this? You talked about this a lot, but like more natural and daily stuff you could do, like to both maybe increase growth or just like to suppress the hair loss type of thing. Do you have any pointers on that?
Yes, I do. Matter of fact, I do.
And
well, they're all gonna include some different elements of either work or chemical or like a natural chemical.
Yeah.
Like I think one thing that is accessible to all that everyone can do is a scalp massage. And if I'd prescribe scalp massage as a hair loss treatment to a person, there's a few things you need to know. First is how to do it, when to do it. Yeah, that's about it.
Yeah.
You start by sectioning your scalp into 3 parts. You have your front part, you have the vertex, and you have like the sides. And you do 1 part for 1 session. And you do a massage session every 12 hours.
Okay.
You could do it every 6 hours too, but that means you might have to get up in the middle of the night or whatever. But
Yeah.
you could do it 2 times a day if you want to like really maximize this strategy. And what you want to do, start off by warming up the entire scalp by press down, and you like rub a little bit everywhere. And you do that for a couple of minutes, maybe 2-3 minutes. Like warm it up, just warm it up a little bit. Rub around.
I can guess that like increases the blood flow in the
so you
scalp.
don't hurt yourself in the upcoming things.
Yeah.
Now let's say for convenience sake that I'm going to do the front part here. What you want to do after the warm up is you do a squeeze. So you take the skin and you pinch it together like that.
Oh, okay.
You do it for a little while there.
Do you hold it?
Yeah.
Yeah.
And you do that systemically all over the part that you're working.
Okay.
And you do that for about 4 or 5 minutes. Then you move over to the second step, which is massaging. You can either do this with your fingers and you press down pretty hard, like maybe 5 kilos of force, 10, something like that, and you like rub the skin. Move, rub, move, rub. But you don't want to cause a lot of friction on the hair follicles, because that might make your hair fall out instead.
Minor
Yes. And when you've done that for 4 or 5 minutes, you move on to the third but last step, which is stretching. And then you just take like that and you pull apart. And you do that in the same way as you pinched all over the area you're working.
Okay.
And you do that same way. You work that area, you work that area, or you work the sides.
Okay.
And a lot of people can feel like somewhere they get tighter on the scalp. Like I have pretty loose skin around the scalp, but it gets tighter up top. Now this is a thing which is believed to also cause the hair loss. Because like as you're getting less and less blood to the area, you're going to get harder and harder skin. And eventually it gets like fibrosed, like really thick, and that shiny scalp you see on some people.
Okay.
Then you're like gone. It's gonna be hard to recover from that.
Oh, I never thought about that.
So you can already feel on yourself like, where does this line go? You might not need it because you have the good hair, and it's a common feature for people that lose hair is that they have a really tight scalp. And that goes for both male and females.
Okay.
So if a woman loses her hair, I would first prescribe scalp massages.
Yeah.
But it's more common for women to start losing their hair in the menopause, when their menarche stops.
Yeah.
Stop getting blood out your gooch.
Yeah.
And well, might also be it's hormonal, but also the side effects of that could be stress. And you're also, during that age, you probably have a lot going on in life. So those combined can cause hair loss as well. So
yeah, I can see that.
but the hair scalp massage is a good tool Do it every like 12 hours. If you want to be lazy, this is what I do. I do one session a day, and I could many instances do like the entire top part or like just the sides, and not like split it into three, but do a little all over and do one a day. I feel like that's way more sustainable than doing two a day, because that's hard.
And you probably have to do it like very frequently.
Yeah, if you don't do it frequently, it's not gonna do anything.
No, exactly, because I know for myself, when I get a haircut, I also get the scalp massage before.
Yeah.
Depending where I do like get my haircut, but oftenly it's always been a part of the routine. First wash the hair, and then maybe some massage, depending on the like hairdresser. But now when I moved to Vasa, I first went to Kava, which is this quite big and popular and maybe more expensive barbershop and hairdressing shop. But then it would be like the first 15 minutes only the like scalp massage.
Okay.
For 15 minutes. And that was really not just really nice sensation, but I really felt it could help as well. And then of course the regular cutting approximately 30 minutes for me, while maybe my girlfriend cuts her hair in 15 minutes. It's like, why do you need all of those extra things? But I always have it like that, and it's really nice.
Yeah.
But it doesn't have the same effect. I do get the scalp massage for the feeling,
sensation,
the sensation. But
but it might be hard. When I did it really frequently, like over 6-7 months ago now, I could almost start like feeling some irritation in the joints of the fingers. You have to be like a little bit careful. I was probably pressing pretty hard with my... So one thing you could do is swap over to massaging a little bit more with your palms. It's a little bit harder, but it's still plausible.
Okay. Yeah.
And there are also like these massage brushes, which I think you could also use.
A lot of
probably.
different tools.
But you have to do it at a certain intensity for it actually to do something. You can't just do like some dilly-dallying brushing around, little fairy dust all over it.
Yeah.
Ain't gonna do shit.
No.
So that's one of the most like natural routes you could take for...
Okay.
I don't think you'd reverse your hair loss if you're like really prone to losing your hair. But if you're like in somewhere in the middle where you maybe start seeing a little bit receding, you're in your 25s, 30s, something like that, throw it in there. It's not gonna hurt. And you might keep that hairline for another 5-10 years longer than you otherwise would have. But you can also throw in some chemicals.
Okay.
Which... Number one, easy accessible, you can get it at any pharmacy, is ketoconazole shampoo. The most common brand here is Nizoral. It's also used for dandruff, if you have a lot of dandruff in your scalp.
Yeah, I've had a lot of that. Not as much anymore, but...
So you throw that in once or twice every week. You put it in your hair when you're lathering it up, leave it in 5 minutes, then wash it. That's all you gotta do. Then you can wash your body while it's in there.
Yeah.
Something like that.
Yeah.
And there are also these, I don't know how much I would believe in them or the efficacy of them, but you can use essential oils. I've heard of mixing rosemary with water, essential oil, and you could mix it into a spray bottle and you spray your scalp twice a day, and that could have a DHT reducing effect as well.
Oh, okay.
The same with the shampoo there. The ketoconazole, main ingredient in that, has a DHT reducing effect.
Yeah.
And if you're already using finasteride minoxidil, I would also throw in a ketoconazole shampoo just because.
Okay.
Might not hurt.
Yeah.
But you can use it as a standalone if you're afraid of starting to bald in the future, or if you're just starting. I would start with the shampoo.
Okay. Yeah.
I don't know about the oils. I feel like you'd get messy in your hair, and it's a pain in the ass to do it every day. And those are also most effective if you combine them with something else like microneedling and but are you getting the growth just from the microneedling or the progress from there, or is the oil actually doing something? I don't know. But a lot of people swear by the oils. It's mostly anecdotal though. Could be that they're trying to sell you the oil. Snakes, oil salesmen. Could be.
Yeah.
But if you're actually balding, go to a doctor, see what they say. If you are sort of just balding a little bit, maybe receding a little bit, try the massages if you care. Want to reverse it, want to keep your hair for longer. Massage shampoo. Yeah, that's it. That's the hair loss segment.
What do you... Shortly, last question before we move on to the last topic, but how do you feel about the connection between creatine and hair loss? Did you experience any?
Well, this is the thing. Creatine is known to increase the DHT levels in your body. But could that cause you more hair loss? Yes, it could. Probably could if you're really sensitive to androgens.
Yeah, that's the thing.
Androgens such as DHT, then it probably will like exacerbate the hair loss.
Yeah.
But the overall saying is no, it won't.
No.
If you're not losing hair, you're not gonna lose hair from taking creatine.
No.
But if you're already like really losing hair, then it might exacerbate.
It depends on the individual and how sensitive you are.
Yeah.
Because I don't think I'm that sensitive.
Yeah.
Because my mistake of taking 20 grams every
Yeah.
day, I would have lost it all by now.
Yeah.
Yeah, but
I think people shouldn't worry about that. I think
I don't
gains
think
from creatine are
I
better.
don't think you should. It's like the same with eating a lot of eggs. It's like bad for your heart or cholesterol.
Yeah.
But it could be if you're like
Yeah.
old with risks of heart disease. Of course, it could be. But if you're young, healthy lad, go nuts.
Yeah.
We ate about 15 eggs a day for a very long time. Months. Good times.
We peaked at 20
It's
eggs
like-
a day.
Maybe not optimal because it's really exhausting to eat that big amount of eggs every day. It was good though.
Yeah, you
Not-
can make them in different ways and
Very bad smelling farts, but we moved that
Occasionally.
Yeah. But it was quite
Yeah.
fun. But should we move on to the last?
Well, I think we could still discuss a connected thing to
Okay.
hair loss, which is like the self-image which males has because of hair loss. And if you start getting hair loss at a young age, it's definitely going to affect your like perception of self. Who am I?
Yeah.
I don't have any hair.
Yeah, maybe
So-
all these like psychological and psychosocial factors, like as you explained, like others' views of you, and like a lot of not stigma, but judging, or like
I think a lot of people would give me flack for this, but I feel like being bald is like being black, or being a a minority group almost, because some people, they see a bald person and the first they think might be something like, if you're not used to seeing a black person, you might react in a certain way when you see them. Same goes for someone who is bald.
he's a porn star.
He's a porn star. He's an astronaut. He's a doctor.
Or
plumber.
every soccer referee ever.
Yeah, true.
They're all bald. I don't
True.
know why. They're stressed out, I guess.
I guess they're stressed.
I understand.
But yeah, I feel like there's a lot of discrimination against bald people, and you can also see this, like bald people doesn't get as good job offers. They don't get as high placings in companies, and
that I never.
Yeah, no, there's like some systemic oppression of bald people.
I could see like that in the beginning how it would affect your like sense of self and self identity, because you build up a certain personal identity from a very young age, which contains a head of hair.
Yes.
So when all that like disappears, it's like you can go and try to reflect that you shouldn't care about it, and this is who I am, and this is enough, and that's great. You should still do that, but it's still a very big part of your like sense of self and identity that's being lost and deleted. So you can't really work around that.
No.
But of course, after adapting all that kinds of stuff, you will have to like adapt your mindset as well, and therefore your maybe philosophy and things like that to live a more healthy life, especially mentally.
Yeah.
Because I can understand that it's a big change, and with a big change often comes a lot of stress, maybe depression, anxiety, because it's not just changing the physical, but also, as I said, when it changes the identity and the whole psychological factors of your mind even. It becomes a quite big issue in the beginning, but with the same as all of the like mentally and psychological factors that changes within us during our life, we need to like adapt not our relationship with ourselves but with others as well, but especially with ourselves, because that's often what creates the maybe mental illness in the first place. It's a lot about philosophy when it comes to mental illness. Often it's just I'm afraid what people would think type of thing, and that's like a very old and quite ancient philosophic approach
to life.
I don't remember if it was Marcus Aurelius or which like started it from the beginning. We could talk about that in another podcast, which we could like deep dive into the great philosophers, because both of us are quite engaged in the philosophic world, and I think it's really important to talk about, because philosophy is very not just underrated, but it's quite stigmatized in a way, or villainized, like we talked about. Because
what are you, a nerd?
Because they like connect the dots to philosophy often to like the parts that's being educated, which are the wrong parts, if you ask me. Like the what did Plato say, or like idealism or things like that. Great topics, great facts and knowledge to know about, but it's the wrong focus. Because if we would focus on the right things in philosophy in schools, we would decrease a lot of mental illness. I would be sure of that. Because it's just a lack of mindset at all in the philosophical like dimension that creates things like depression, anxiety, and things like that. Because when I started like deep diving more into things like stoicism, my like I didn't have that mental illness before that strongly, but I would say right now it's like the best and the most stable it has been in a quite long time, due to that. A lot of other factors as well, of course, but it was a big part of it. But yeah, should we move on shortly to the last topic? And lastly, I wanted to talk about, it's training related.
Yeah.
I'm writing a talk about this. I'm writing a little about it in my book. And the topic is specialization training versus variation training. And also how it could be implemented in real life as well. And for those of you who don't know what this is, it's like specialization training often revolves around a type of training approach which masters one certain skill, one certain lift, and only like puts a lot of focus on only that.
Yeah.
Other factors as well within this approach, but that's like what I believe is the main aim of it. And the variation type of approach is like the name says, is like variated training. You explore a lot of different variations within a movement, not just only doing the barbell back squat. You may be exploring the plat squats, the pause squats, the box squats, the SB squat.
Couldn't that be like special, like focusing on the squat? Isn't that more like...
Yeah,
know.
it goes hand in hand.
Yeah.
But I believe the variation is like you variate many different types of like both approaches in a movement, but approaches depending on your goal as well. And I wanted to talk about this because I do believe you need both. Sadly, I've always been on the like variation route. Because I always had the like philosophy and mindset of like doing the things that no one else is doing and thinking outside the box. And with that comes a lot of like trying new stuff.
Yeah.
Especially stuff that no one is like even heard of. I like hate doing the basic, only like bench, squat, deadlift, like the ordinary variations. I often use deficits or maybe tempo or pauses, things like that. That comes a lot from powerlifting, but still a mindset I've had for a long time. But you can't not only use that. That was my issue. I only did the variation part, not as much of the specialization training, like only focusing on one certain lift. That's also something powerlifting is very good at. And I learned that approach from powerlifting. So now I can better use it in a balanced manner. But I do believe that's really important. Do you have any pointers and opinions on this? Or how have you used it in your training?
Well, I think that depends on how you define it. But I have definitely...
That was my definition, but I don't think it's the official definition. It's just my point of view.
Definitely messed around with different variations of like one lift.
Yeah.
I've done different stances in the deadlift. I've done deficit. I've done a non-deficit, more like a block pull, almost to a rack pull, which is almost like a deadlift kind of still. It's part of that is a deadlift kind of.
Yeah.
And I've done different bicep curls of all kind of variations. But I feel like I always go back to the ones I love.
Yeah, same. And as we talked about earlier, that was one of my issues as well. I only focused on my like strong lifts.
Yeah.
And that's, you could look at that in a sense of specialization. I only did the overhead press because I liked it, because I was strong at it. So when I saw I like had potential, I'm pretty strong in this lift. Of course I went to like, let's see where it could take me. Let's max it out. I'm already strong in it, but I want to be stronger. But the issue there was I forgot about the weaknesses when I only focused on my strong lifts. But now I picked that up again, so even more balance. But it's a easy trap to fall in. I'll give it that. And I talked about how you could implement this to life as well, not only in the gym.
Ah, okay.
And I talked about balance between these. And you could see like the variation is like you trying different type of movements. Same in life. You wanna try new things, different kinds of things, whether it's in your daily life, in relationships, or in your daily routines, because then you often find new things that maybe works good for you that you didn't know about because you never tried them.
Yeah.
Same goes for specialization in a way. You focus on maybe one thing you want to get good at. If it's a sport, it's a maybe daily routine you want to get better at, engaging in activities like cleaning or making your own food, or things like creating and improving independency.
Yeah.
You maybe want to lay up one certain activity and just focus on that instead of like, I want to increase my time with my friends, or more time focusing on cleaning my apartment. It's easier if you choose one and focus on that one, and when you see you make improvements, you can go on to the next. But if you like, I want to get better at all of this stuff, the progress will stagnate.
Also in life, if you learn to do something, it could become almost automated and quicker at some point. That's why if you really learn something to do well, then it will be easy to do that, and you can learn something else.
And the other thing, how you could like connect the dots between training and life, is that if you talk about motivation and maybe standards, maybe to like get motivated and especially maintain motivation, you need the activity to be realistic, aka you need it to be within your capacities. And that often means it needs to be very easy. This is one big issue which makes a lot of gym goers, beginners, stagnate or even fall off training in the beginning because they set unrealistic goals. They go way and beyond. I want to be able to lift this and that, and that's unrealistic in the first year of training, because then it's about learning what you want, what you can do, not what you should be able to do later on. So I would find the balance between doing the easy things to get motivated and stay motivated. And then when you got that settled, you want to like increase the standards and improve and like keep going higher and higher to reach your potential. And I think the same goes for like life.
Yeah, I agree.
To like
I agree.
Try new things or learn new things. You need to pick up the realistic aim to get started.
Yeah.
Let's say if you're used to, let's say, not making the bed or cleaning the house at all, it won't be realistic to say, I should clean the house 3 times a week.
Yeah.
That's unrealistic. Maybe just clean 10 minutes once a week first to get the routine. Then when you got that, you can either increase the time, clean maybe 1 time a week 30 minutes, or keep the route of 10 minutes but increase the time of the week. Two things, and these are also a common methods we both could use as occupational therapists, and that's why I also bring it up here, because it's very basic if you think about it, but it's something that a lot of people don't think about. But this is like I said, something I want to bring up in my book, because that's something I realized, that the gym hasn't just learned me about my body physically, also psychologically, of course, but especially it has learned and taught me a lot about life itself, because a lot of approaches in the gym is also reoccurring in life.
I just realized that a lot of people are ego lifting outside of the gym.
Yeah, yeah, but it's true. It's really true.
That sounds funny.
Yeah, but it sounds funny, but it's really true.
Yeah,
and it's really the same way. And we will wrap this up. But realization I had when I wrote this is that I talked about standards before.
Yeah.
That I've had quite high standards and expectations of myself in the gym, but quite low in real life. And I thought, why is that? And I don't have an answer why, really. Because I really always felt like the gym was a different place. It was a big part of my identity, and therefore I could go a lot higher in that. I didn't have that same purpose in maybe other areas of my daily life, so therefore maybe not as high standards.
Yeah.
Just a theory. But lately I have been increasing and trying to adapt my mindset and the standards in my daily life as well, treating my daily life and daily routines as the same as the gym. Therefore, increasing standards, which also means increasing performance, increasing health, and overall like wellness.
Yeah.
Yeah.
That's what it's all about.
It's all about wellness.
All right. On that note,
we'll wrap this up.
Should we say
what?
Goodbye?
Goodbye.
Signing off.